I know that the champions today are going to be talking to a whole range of partners. And as the co-chair of the Place Space Board, so that's across Westminster and Kensington and Chelsea, I can tell you that there's never been a more important time that we connect to our communities.
For me, the work and the programme of the Community Champions is very much how you define integrated care systems, because it's about different organisations and different communities coming together to really articulate what the issues and what the challenges are.
The long-term point is to reduce health inequalities. Westminster, even though it has good services and it has one of the highest life expectancies in the country, the life expectancy gap between the richest and the poorest is also the highest in the country.
It's all about tackling health inequalities, and we see that the voluntary and community sector has a role in that. So that's what the place-based partnership, we're very much embedded within the local partnership.
We use our positions to influence as much as possible the role of the voluntary and community sector, the role of community asset building, trying to encourage the health system to divert resources into prevention, into the voluntary sector, so that we can do what we think we do best.
Our Health and Wellbeing Board plays a really important role in bringing together the health system, the social care system, the voluntary sector systems and our local communities to understand what the health and wellbeing problems are in our communities, to collectively think about what are the initiatives we need to do to address those problems, and to look together at whether or not we are being impactful. And that's at the heart of integrated working and joined up working, which is so important for our system.
Our future for our integrated working is about the development of integrated neighbourhood teams, which is about being hyper-local, delivering what communities need, and the voice of the community champions is key as we deliver that from the ground up of what communities need, and then how we have that strategic vision at the top and how we bring that all together to address wider health inequalities.
We can achieve more when we work together. So I think by working in partnership, we understand one another, we understand the roles and the services that we're involved with, we understand the needs of our community, and we understand the ways in which we coordinate together in order to deliver as best as we possibly can for our residents.
More and more projects and more programmes, we work together collaboratively. We make better use of the resources and assets that we have. And we learn a lot from partners.
What we're looking at is trying to have that earlier support with families. The pandemic was a great example of people coming together in an organised way to support families locally.
The community champions, how we work with them, is really include them, involve them as a first point of contact for resident groups and for community organisations. And they're great to work with because they have such a knowledge about what really matters.
Joining the Champions was a new chapter in my life, changed me inside and out. I attended different trainings, including baby massage, birth and beyond birth, and breastfeeding peer support. I now provide support to new mothers and babies.
Our hope is to inform our community about all the wonderful activities that we do, but also about services that are available to them.
My role in a nutshell has been to build a trusting relationship so I can promote healthy lifestyles.
Social prescribers support general practitioners in their work by freeing their time from dealing with non-clinical issues that affect the health and well-being of their patients. GPs refer such patients to someone like myself, and then we connect them with organizations and services.
I think we've made a great start in terms of bringing together integrated care partnerships, because rather than working in silos, cutting across organisational boundaries, working together, really using the best of all our resources. What I'd like to see happen is to now enact the change in a way that's possible.
The place-based partnership is really important because we want to involve every aspect that we possibly can about different places in the borough and different organisations within Kensington and Chelsea as well that can really improve the lives of our residents.
There's one person, and for all of us, one goal is that that person is whole, healthy, and knows what to do.
So what we're hoping to do in the long term is to give people the tools to keep themselves well and healthy within their own environments, and give them sort of like techniques and skills, and also giving them the skills and knowledge and confidence to come forward to access healthcare services.
My wish out of all of this is for it to be a smooth entry from when you first get help to when you leave the service, essentially. And if we can get everyone every step of the way to be aligned in their vision, then I think we're hopefully getting there.